Resistant high blood pressure. Now, most people have been complaining that despite their drugs, their blood pressure still remains high. Despite everything that they've done, stop taking salt, all of those things, their BP are still high, managing what they are eating and stuff, taking their drugs. So I'm going to be telling you almost about 12 things that you're doing or that is maybe causing you to have resistant high blood pressure. Resistant high blood pressure means when you've taken medications. Most people are on 2 types of medications and the BP still remains above 130/80. Okay, so these are the things that is causing it. And after discussing about the causes, then I will tell you remedies how you can manage this. Number 1 reason of your blood pressure always being on the high side, or it seems like your drug is not working, is sometimes not checking the blood pressure machine adequately. Okay, not checking your BP adequately. Most people might just be moving around, or they are not having the correct cuff size, BP cuff size in the house or something. Okay, so they are standing. So these are the things that affect your blood pressure. When you are checking your blood pressure, you're shifting your hand, the cuff is not your size, the machine is faulty. So this may be the cause of your blood pressure always being on the high side. Okay, number 2, just like I've been saying, in fact, it's supposed to be the number 1, diet, lifestyle. Diet is one of the major leading causes of high blood pressure. And if you're hypertensive, at least by now, if you're on this page, by now you should have known that you need to eliminate salt or almost eliminate salt from your diet. Okay, I've already told us the daily recommended salt intake, which is it's a teaspoon. You can, for everyone, but if you're hypertensive, you can take lesser. So try to read food labels, check, try to cook food yourself, because it may really go a long way for you, because you don't know what the extra salt or salt derivatives that have been added in fast food. So this may be, if you're always eating out, or if you're always eating salt or adding extra salt after cooking, just have it at the back of your mind that your BP will be very difficult to come down. Okay, now number 3, some medications. it is very important to note that some medications can actually be increasing your blood pressure. So you're taking antihypertensive drugs, BP drugs, and then you're taking some medications that is counteracting it. Okay, your BP will not be optimal, the drugs will not be working. Okay, for example, some hormonal drugs, for instance, contraceptive pills. Okay, these contraceptive pills, they increases the blood pressure. So that is why it's advisable for women that are on contraceptive pill to always check their blood pressure and not be on it for a very long period of time, right? I've seen people that don't have high blood pressure, that this thing has caused high blood pressure for them, this emergency contraceptive, for a very long time. So hormonal pills, emergency contraceptive, can increase your blood pressure. Taking some, what is it called again, herbal mixtures, some herbal mixtures that people sell online, this will cause increase your blood pressure. So you have to be very careful, and also damage your kidney. So you have to be very careful. Sometimes taking coffee too can increase your blood pressure, especially when you're taking your drug. So you can take decaffeinated coffee, or just limit to 1. If you're hypertensive, I hope you know that coffee increases the heart rate. Okay, so the next thing that does this in part of drugs is some drugs also like analgesics. Okay, diclofenac, analgesic, those painkillers, aspirin. Okay, abusing these drugs can also be increasing your blood pressure. So if you're having pain, or having any recurrent pain, I suggest you see your doctor, especially when you're on hypertensive drugs. Okay, so they will monitor you and know the direction that it should be taken. Remember, these non-steroidal anti-inflammatory drugs like diclofenac, ibuprofen, Novocaine, paracetamol, they all, if you abuse them, they can damage your kidneys. Okay, you can look at the video of 12 things that will damage your kidneys. There's also another video on how to take care of your kidneys and signs of kidney failure. All those videos are here. Please locate them and watch them. Right, so the next thing that increases your blood pressure or makes your blood pressure medication to seem not to be working is a condition called white coat effect. This white coat effect is when some people, once they get to the doctor's office or when you want to check their BP, they are scared or something, their BP just suddenly rises. I've seen a comment section like that on the last video I made on why your BP is up on my TikTok. Meanwhile, if you're here and you're not on my TikTok, you may be missing a lot. So this white coat effect is one of the reasons. It may be one of the reasons why your blood pressure is high. But when you go home, if you check it, you find out that it's low. Okay, so if you're having this effect, your doctor will do what is called ambulatory BP monitoring. Okay, if they find out, just discuss with your doctor, because most of the time they might not know. You just tell them that this time I come to your office, my BP is high, but when I get home, it's normal, right? So they will put that thing Holter ECG or ambulatory BP check. Okay, when you get home, even the ECG, Holter ECG is you get. So when you get home, your 24 hours BP monitoring, the BP will be monitoring. They'll put it on you. You just do your normal activities, do what you're supposed to do. It will be checking. At the end of 24 hours, you even sleep with it. You go back to the hospital, so they will take it and check through the machine. It's just a very small machine. Then they will now see how your BP trend is. That is when they can finally find out that if you are actually having BP issues or not, if it is white coat, if it is because of the doctor or not. Okay, so this is one of the reasons, because of this white coat effect. Now the next thing in the type of life factors is alcohol and smoking. You can't be smoking and you are taking high blood pressure, you're hypertensive, you're smoking. It will not work. You're wasting your time practically. Okay, you're even stressing yourself, because you're stressing yourself. I don't want to make this video over long. It will just be working small, and smoking already increases blood pressure. So it is not even, you have to stop smoking. Your BP meds will not work, and you're straining your heart, your organs at the same time. And alcohol, you have to stop taking alcohol if you're hypertensive. Okay, so these are the things that I don't know the number that I am in, but as you can see, these are the things that you're doing that are affecting your blood pressure. Now the next thing that can affect your blood pressure, make your blood pressure come up, or if you're already hypertensive and your drug is not going to work, is not exercising. Yes, if you're not exercising, it will not really help you. At least every day, have at least 4 times in a week. There's been recent studies. Do aerobics. Aerobics, just walking, like dancing. If you cannot go to the gym, if you cannot use the treadmill, just walking, dancing. Go to a gym where they walk or dance, or you can go to the gym and maybe use the treadmill, use the bicycle, walk around, 4 times in a week. Trust me, this thing, when you do this exercise, your heart pumps blood with ease. It reduces strain on your heart. If there is any clogged, your cholesterol level is high, it will help you a lot, so that one of the, fatty plaques will not just pump off and go and block any major blood vessel, and the person may have stroke or heart attack or something. Now that reminds me, watch the video on heart attack, causes of heart attack, and another video on how to protect your heart. Look at all these videos, okay, especially if you're hypertensive. Okay, so smoking, exercise will really help you. Okay, so I think I'm already doing the causes of resistant high blood pressure and the cure at the same time, so please take note of that. There is another causes of this is what is called stiffening of the arteries. That particular side you check your BP, maybe the arteries supplying the blood there where the pulse can be felt, and probably it's stiffened. Okay, maybe you've checked BP for a while, and it's stiffened or something is wrong there, or structural malformation, so you may be getting high reading or reading that are not accurate. So your doctor will also have to put those things in consideration. Okay, so the next thing that can cause this, wrong medication or wrong dose. Okay, each individual has a drug that they are supposed to take. So this is why it's not actually good to give prescriptions online, because you don't know the person's full history. For instance, if you're having chronic kidney failure and somebody are just having a normal high blood pressure, chronic kidney failure induced hypertension is usually high, so the medications is not really as normal as the one they give just a normal high blood pressure, because their high blood pressure is usually high and they usually have resistant high blood pressure. Okay, or you may be taking the wrong medication, or maybe the medication you're taking is not enough. Okay, so all in this aspect of wrong medication or wrong dosage, or maybe your medication is supposed to be up a little, you're supposed to be taking 100 milligram and you're taking 50 milligram. All you need to do is you have to go to your doctor for readjustment. When you find out that you're doing all of these things that we are mentioning and your BP is still up, you have to meet your doctor. Your doctor will review you and do some tests, which I'm going to mention later, and then send you, review your medications, give you another set, monitor you, and be fine. The bottom line is that when you're having resistant high blood pressure, you don't just relax thinking it's going to calm down. It will stop. Go back to your doctor, let your doctor know, and put into consideration all these things I mentioned, and also let your doctor know, so that something will, remember, when high blood pressure is not managed, you know what it can lead to: kidney failure, stroke, heart attack, heart issues, lots of things. So you have to really take it into consideration and be serious. Heart failure and the rest of them, and be serious, or when your blood pressure is high and it's not coming down. Okay, so the next reason for this is some medical condition. You may be having an underlying condition. This is the most important factor. If everything that has been done, your BP is still high. So there are some illnesses that can make your BP to be high. So despite anything that has been done, it will still be high until the illness is tackled. For instance, kidney disease. Okay, hormonal imbalance, even sometimes sleep apnea, which is a condition where you suddenly stop breathing when you're sleeping and then you continue breathing. Okay, stress also. I forgot to mention that stress, you need to try to find time to rest. Okay, so in the conditions that can, kidney disease, some kidney failure, abnormal structures, okay, in the kidneys, where the kidney cannot receive a lot of blood supply. Okay, and kidney is responsible for maintaining your blood pressure. So that is why when the kidney fails, the blood pressure is always on the high side. Okay, so you have to take all of this into consideration. And if you are having resistant high blood pressure, please meet your doctor. After doing all of these things and it's still high, meet your doctor. After changing your lifestyle pattern and it's still high, meet your doctor. So let's get to the treatment. The treatment, like I've mentioned earlier, you have to meet your doctor. Okay, as I've mentioned earlier, I think I've mentioned all of the treatments. Reduce your salt intake, work out, exercise is very important. Check your BP monitoring machine if it is still in the right size. Your cough is okay. Check your hands. Get the correct cough. Okay, white coats high blood pressure. If it is as a result of white coats symptoms, your doctor will send you home with a 24-hour monitoring BP machine that you can wear around, go to work with it, nobody will know, and it's checking your BP per interval to find out, and afterwards they can get the reading, and check you out, and some illnesses, underlying conditions, some medications that you need to stop, some things, habits you need to stop, smoking and alcohol, some drugs, herbal medicines, and all of those things. So this will really help you. So your doctor will do some tests when you go back to the hospital. For example, urinalysis, he will check your kidney function. He will, if you have high blood pressure and diabetes, I have videos on the test that you should do when you have these two illnesses at least twice in a year. Please locate the video. So it will check your echocardiogram, you check your your ECG to find out how your heart is functioning, and any other underlying conditions will be found out and you'll be treated promptly. So I hope this video helps you. Let me know what you feel about this video in the comment section. Like and share so that YouTube will suggest the video to other people. Okay, I always forget to mention that my name is Nurse Merit and I'm a nephrology nurse.